Hi, and welcome to Karma Talks. This is Mark Hughes. This is a very interesting day today, May 4th. This is where the legislature, the House, passed the American Health Care Act. And with us, we have Dr. Carol Paris. She's the president of Physicians for a National Health Care Program. Right. Carol, welcome. Tell us, what do you think about what happened today?
Well, I think what happened today is that the Republicans showed their true colors and passed a piece of legislation that it was more important to them to uphold a campaign promise of Donald Trump than it was to actually go through the process of thoughtfully considering what the effect of this legislation would have on the American people. And all I can say is shame on you.
Well, what I'm hearing is that if there's good news about all this, is that they're saying this has gone through the House, but when it goes on to the Senate, it's going to be a much steeper uphill climb.
That's true. That is what I'm hearing as well. I'm not a political pundit, but that's certainly the what I'm hearing is that they're going to have a hard time convincing a majority of the Senate to get behind this.
Yeah, and I agree with you that it seems like they were a little premature, and there was definitely other motivations behind this than really to create a wonderful healthcare program for Americans. The Congressional Budget Office hasn't even been able to put in their 2 cents and evaluate this new proposal before they've rushed it through for a vote.
And I think that may have been a calculated decision, because it's quite possible that if the CBO had scored it, it would have actually been deemed even more negative than the AHCA 1.0 that never even got to a vote last month.
So what are you and your colleagues seeing as the big problems with this? Identify the top 3 biggest concerns you have.
Well, I think that the biggest problems are that it will, in fact, eliminate for about, judging from the previous CBO scoring, approximately 24 million additional people will lose health insurance. And especially for people in the 50 to 64-year-old age range, because it eliminated the individual and the employer mandate, it means that, and allows insurance companies then to charge more to people who are older and sicker. Their premiums are going to be unaffordable. And so we're going to have many more people who are not able to afford insurance.
So is this something that was, rushed through because the insurance companies were pushing it through, or the Republicans wanted to just get it through, or is there just, it just seems that there's an insensitivity to healthcare needs in America, and how is this happening?
I think you're right that this is being rushed through, and I don't think it is actually so much at the bequest of the insurance companies, because actually I think a lot of those insurance companies are not keen on this piece of legislation either.
In what way? In what way are they not keen?
In that it isn't necessarily stabilizing the insurance market. It may even be even more destabilizing to the insurance market. So I don't think this is happening because the insurance companies got behind it. I think it's happening because President Trump wants a win, and because he has 2 shots at using reconciliation. I think it's before June 15th. And he wants to use that political maneuver to pass the healthcare reform legislation and tax reform, which requires a fewer number of votes in the Senate than it would if he didn't go through reconciliation. So I think that's the reason that there's this rush to make it happen. It's meeting the needs of the president and
in what way? How is it meeting the needs in the president just to obtain his?
Because he wants to use reconciliation, and he promised in his campaign promises that he was going to repeal and replace the Affordable Care Act.
And he needs a win.
And he needs a win.
Yeah. So we're gonna take a win for President Trump at the cost of the American people. So let me ask you this:
at the cost of not just a few American people, the actual majority of the losers on this are in southern states that voted for Donald Trump. So the losers are going to be, in many cases, the very people who voted for him. And I think that that's a real tragedy.
Well, we still have a ways to go. It's going to be an interesting journey when it goes on to the Senate and people start weighing in and there's political pressure and all that's happening. But from a historical perspective, you know, you look around the world and there's other countries that have a very strong and stable healthcare system. Why is this so hard in America?
Why is this so hard in America? Boy, I wish I could answer that. We seem to embrace this idea of rugged individualism, and if you work hard enough, you too will succeed and reach and achieve the American dream. And if you need to rely on the government as a social safety net for you, then it's because you aren't working hard enough and trying hard enough. I think that's a message that is built into a lot of our history, and especially in the South, where people are very, very proud of their ability to come together as a community, to look out for each other and not to depend on the government. And so I've just been reading Strangers in Their Own Land, a book by, I'm blanking on her name, Russell, Strangers in Their Own Land.
Okay.
And the author spent a great deal of time in southern Louisiana, where she spent time with people who are self-identified Tea Party Republicans. And she was really going to get a better understanding, a real deep understanding of how people could vote for something that was clearly going to be not in their best interests. And what she said from the absolute get-go is these people are not ignorant. They simply have a deep story that is different from that of liberals. And part of their deep story is that we are hardworking people who are independent, and we want the American dream. We're willing to work hard for the American dream, and we resent anything that we feel interferes, whether that's immigrants or African Americans or, you know,
free healthcare,
or the federal government mandating that they purchase health insurance. And frankly, I can agree with them on that. I don't want to be mandated to buy a lousy piece of health insurance either. So I'm totally on board with Republicans who are against the mandate.
So Are we
David,
talking to the same? Are we
crappy
talking to the same?
insurance either.
I'm sorry. I'm sorry. I
I don't-
interrupted you.
Oh, well, I'm just saying, the more I study this issue, the less divisiveness I see between Tea Party Republicans and liberals. We actually want many of the same things. Our strategies may be different, but we want the same things. And I want quality, affordable health care for everyone in America, including people who may not, in the broader sense, agree with all of my liberal politics, because healthcare should not be a partisan issue. Everyone needs healthcare.
Well, I read an article a couple weeks ago. They did a study and they looked at the wealthy, and they really truly have a hard time understanding or appreciating what people that are less fortunate go through and how to really cope and deal with that. And I have to say, I fall victim to that because it wasn't too long ago that I was thriving and things were going well. And in 2008, I was very humbled by the economic crash because I was very involved in real estate. And it was very humbling because I came out of that, or prior to that, I would say to people, well, just go get a job. Just go get a job. What's your problem? Just, go get a job. Well, post 2008, I had a very hard time getting a job. And I've developed a whole new appreciation to those that are less fortunate. And we that are more fortunate, those of us that have the ability to be more supportive of those that don't have those skills or abilities. But in what you're suggesting with a single payer, how does that come into play in a way that's not intimidating to those that have the wealth?
The way that a single payer is a much, much more equitable solution is that it isn't just a program for poor people or older and sick people like our current Medicaid and Medicare programs. What it is a single publicly or quasi-publicly funded risk pool. And we know that the larger the risk pool, the more stable the insurance is. We're saying, let's make this the most stable, conservative risk pool known to man. And that is achieved by everyone being in the same risk pool.
So why are people resistant to that?
Because they don't understand it, and because of a lot of negative campaign or negative ad campaigns that are paid for by the for-profit insurance industry. Because really the way that a national improved Medicare for All plan works is that we eliminate the middleman, which is actually a very conservative business decision. I mean, businesses do that all the time. They look at how to reduce their overhead and increase their profits. And as much as possible, they say, well, let's just get rid of the middleman. Well, we're saying, yeah, let's do that. And the name of the middleman is the for-profit private health insurance industry.
That's a big industry with strong lobbyists and a lot of pressure on Washington. Can you beat them?
That's correct. That's why we have, as activists, our work cut out for us. We need to build a movement in this country that is so strong, so active, so sustained, and so large that it becomes politically toxic for our members of Congress not to get behind it. And as far as the insurance companies, I do want to point out that when we eliminate the middleman. Written into the legislation is both unemployment compensation for a period of time and job retraining for people who would lose their job in the for-profit administration of health insurance business. And that's not all, while that is a large number of people, many of the people who are populating that field are actually people with clinical licenses, doctors and nurses who got burned out on the clinical side of healthcare and went into administration because they just got tired of trying to provide good care. Those are people that could go back into the delivery side of healthcare. And this is a job creator more than it is a job destroyer.
Wow, it's amazing. Okay, we're gonna take a quick break, and then we're gonna come back, and we're gonna jump into more details about the plan and answer some of the critical questions that some people are asking that make this plan a tough plan to sell. But we'll come right back and we'll talk about that with Dr. Paris.
As a result of foreign competition, our gross profit margins deteriorated. We had to watch every penny of overhead.
Every penny, every half penny on this product.
And the one area that was so confounding was healthcare costs.
Every employer I know, they dread the next hike in their insurance rates.
The current costs of the system are becoming intolerable.
Why are we creating an extra hurdle for business? It's tough enough out there.
We looked at opening up a U.S. operation. If I had to increase my costs by over $1 million because of insurance coverage costs, that alone would probably drive me to bankruptcy.
Why are we making it harder for people to provide goods and services to the American public while employing people and providing tax revenues?
Healthcare costs are going up 2 to 2.5% above the projected gross domestic product. So it is running away from us.
Health insurance is a really complex system.
I cannot read my insurance policy. I don't understand it.
The variation in what hospitals are getting paid was more dramatic than we thought.
How are the prices set? I'll wager you have no idea.
Nobody really knows what it costs, and what healthcare systems have learned is that they can charge whatever they want.
You see, there's no accountability. The buck doesn't stop anywhere.
Our current broken healthcare system is the most rationed healthcare system in the world. That's why 1/3 of Americans don't get the healthcare they need.
Pity the poor company that's more labor intensive than us. They are going to suffer dramatically. And if they are having bad years, if they're on the verge of collapse, this is going to push them over.
We are undermining our capacity to function, let alone compete as a society, because of the rising costs of healthcare.
If I told you that every one of your employees could get the health care they need guaranteed, that your costs would go down, everyone would pay less and get more, you might be skeptical.
Just imagine what it would mean for this country if we could cut our health care bill by 25%. Imagine what it would mean for our business community not to have this albatross around their neck. It would be extraordinary.
Hello and welcome back. Mark Hughes with Dr. Carol Paris. We're talking about the healthcare in America. So, Dr. Paris, you're saying that your single payer program would save billions of dollars. How so?
We have done the research, and it clearly shows that in the United States, we're already spending twice or more what any other developed country in the world is spending on healthcare. And they're covering everyone, and we're leaving 30 million people out. So we're already essentially paying for a national health program. We just aren't getting it. So where is all that money going? Well, it's going to the bureaucracy and the administrative cost and the profit of the for-profit insurance industry. And if we could eliminate that, we would actually save, different studies come up with different numbers, but somewhere in the vicinity of $500 billion, that's billion like $500 billion a year.
In what specific ways?
By eliminating the profit and the administrative cost of administering a multi-payer for-profit insurance industry. It takes a lot of people to figure out how to cherry pick the healthiest people into your particular insurance plan and lemon drop the sick ones out. If we didn't, and to advertise your plans and to, there's a lot of waste that goes on. Right. Not to mention, as a practicing private practice psychiatrist until very recently, I personally had to have 2 full-time employees whose job was entirely chasing money, just trying to get me paid for work that I had done.
From the insurance companies? From
the insurance companies, absolutely.
Right. So on the single payer program, does everybody pay the same premium?
No, and that is another one of the hallmarks of a single payer improved Medicare for all. While we do have to raise taxes, those taxes would be progressive, not regressive. So people who make less pay less, people who make more pay more. And even taking that into consideration, 95% of Americans at the end of the day, even though their taxes would go up very modestly, by eliminating all premiums, all copays, all deductibles, all coinsurance, 95% of Americans would have more money in their pocket and significantly better, more comprehensive health care.
So if you're saying this would save billions of dollars, why do we need to raise taxes? Because that's a hard sell for a lot of people, when we have the huge deficit that we have, to say, let's just raise the taxes.
Right. And that is that's a difficult thing for many people to hear. And that's what some of the groups that will be coming out saying this is unaffordable, all they're going to point to is that we would have to raise taxes. But what they're not talking about is all the money that people save by not paying premiums, co-pays, co-insurance, and deductibles. So yes, there is a and what that progressive tax is replacing is premiums, co-pays, deductibles, all the things that get in the way of people actually using health insurance. Because the other thing you have to understand here is that not only would a single payer Medicare for all insure everyone, including the people who right now have no insurance, it would also improve the benefit package for people who, including the tens of millions of people who currently are underinsured. These are people who qualified for insurance through the Affordable Care Act, or maybe they've got good insurance, decent, whatever that is, insurance through their employer. But when they get sick, they still say, well, I've got that $500, $5,000 deductible, and that's going to come right out of my pocket. So, I'm having a little bit of chest pain, but, I'm going to just hope that it's heartburn.
So how would it be otherwise? How would it be the single payer? How would it be different?
Well, if I don't have to worry about copays and deductibles, if there are no barriers to care at the point of service, if I'm a 64-year-old woman with a family history of heart disease and I start having chest pain, guess where I'm going to go? I'm going to go to the hospital. I'm not going to scratch my head and say, well, maybe it's heartburn and, gosh, I've got a $5,000 deductible and I don't want to go to the hospital and find out that I have heartburn and come home with a bill for God only knows how much. My niece took her son to the hospital when he fell in the tub and needed 3 stitches. She mistakenly took him to a hospital that was the closest hospital rather than her in-network hospital. And she walked out an hour later with 3 stitches and a bill for $2,000.
Wow.
All of that goes away if we have a national health program, because there are no barriers to care at the point of service. So
And
people
can you go in? Would it be that you would go into any hospital or
any hospital, any doctor?
It's sort of like one. It's one healthcare corporation entity, one entity.
No. The funding is one entity. That's publicly funded. But people are free to go to any doctor, any hospital they choose. The delivery of care would remain private. And people could, as a physician, if I wanted to work for a large group practice and get a salary, I could do that. But if I wanted to open a private practice and simply bill patients and get paid, I could do that.
So I come from a history of physicians and seeing the change that's taking place. And I think it's interesting that you represent physicians in your organization. It seems to me that a lot of physicians are reluctant to get into a position where they're being told how much they're going to be compensated for providing certain services. We
already are. Again, I was a private practice psychiatrist in a community where I felt that it would be unconscionable for me to have a boutique practice where I said, I'm just going to charge people what I charge. I don't accept any insurance. And if you can afford to pay me, great. If you can't, you're out of luck. So I accepted all of the insurances. And let me tell you, the insurance companies basically say, this is our fee schedule, take it or leave it. So that is, if we had a national health program, it is going to include a fee schedule that adequately compensates physicians for the care they deliver. Now, I will agree that some of the most highly compensated specialties, like orthopedic surgery, may not make the incomes that they have in the past. They're certainly not going to be paupers. They're going to be compensated well.
But how many physicians do you have in your organization?
We are an organization of 20,000 physicians, medical students, and health professionals. And I do want to point out that this concerned me in 2009 when I was working on healthcare reform and living outside Washington, D.C. I opened the Washington Post one day and I read another article about, this possible Affordable Care Act, and it said the AMA says blah, 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 blah. And I thought, oh my gosh, I wonder how many people reading this think that the AMA represents all doctors.
That's my assumption. I would assume that if...
Then I would like to correct you, my dear.
All right.
The AMA actually represents less than 26% of physicians, and the majority of them are retired and or specialists. The AMA is more of a trade group for wealthy doctors who are looking out for themselves than it is actually an organization that represents the majority of physicians. Because poll after poll shows that even the majority of physicians, when asked, want some form of national health program.
Interesting. Yeah, you wouldn't think that. That's interesting. It's very
The
fascinating.
Surgeon General last year identified his two biggest public health concerns for 2016. Number one was the opioid epidemic, and number two was physician burnout. Physicians are getting burned out by all of the bureaucratic nonsense that gets in the way of them delivering the kind of quality care that they went into medicine to practice in the first place.
Right. I've certainly heard that from my brother, who's retired after 35 years, telling his story of the transition in healthcare and what fuels it, what moves it along. I would think that a single payer system would eliminate the overhead, the cost of insurance companies, but also pharmaceutical companies. I read an article the other day that said that hospitals that restrict representatives from pharmaceutical companies from having access into the hospitals and promoting their drugs, that physicians are more likely to recommend generic drugs versus those that are being touted by reps that come in and give them gifts and do all that kind of stuff. That would go away, right?
That very much would go away. And our co-founders, Dr. David Himmelstein and Steffi Woolhandler, did some additional research that showed that if we simply could negotiate drug prices, we could save an additional $100 billion or so a year in drug prices.
The other thing, one more thing that I thought was fascinating, and I think this is correct. I think it came from one of Michael Moore's movies or whatever, I'm not sure. But I think we're either the only country or maybe one of two countries in the world that allow pharmaceutical companies to advertise on television.
I actually have practiced in the only two countries in the world that allow that, the United States of America and New Zealand.
New Zealand.
When I closed my practice in 2012 in Maryland, I moved to New Zealand for a year because I wanted to work in a country that actually has a national health program, so that when I came back to the United States and continued to advocate for Medicare for all, I could say I've actually worked in a country that has this. And guess what? It isn't perfect. It's just a whole lot better than what we are doing. And I believe that the American people, being the resourceful people, the intelligent people that we are, we could make the world's absolutely best and most conservatively funded, liberally delivered healthcare system in the world.
So how do we do that? I'm with you, but how do we make that happen? We got an uphill battle, girl.
Well, I recently was having a conversation with my congressman, Jim Cooper, who is a Blue Dog Democrat in Nashville, Tennessee, who had never co-sponsored HR 676 before. And what he said to me in one of our later meetings, when he actually is now a co-sponsor of HR 676, two things. What he said was, I think it was what the Republicans are doing was so reprehensible to him that he said, I just can't be a part of this. And it's almost, we've like Winston Churchill said, if you can count on the American people to do the right thing, but only after we've eliminated all the other possibilities. I think what the conclusion, and I don't want to put words in his mouth, but the sense I got was that Congressman Cooper was saying, we have eliminated all the other possibilities. And I know my congressman is a fiscal conservative, and I want him as a co-sponsor of HR 676, because as he said to me, Carol, I don't want this bill just to pass. I want it to succeed. And it's going to succeed by having fiscally conservative people making damn sure it does succeed. So there was that. And I was going to make another point, and now I've forgotten what it is.
Well, to jump in there, I would say that I'm a fiscal conservative.
Mm-hmm.
Socially, I'm liberal. And I would think that your program is one that fits that. So those people that are whining about the money, I'm sorry, go ahead.
I remember what I was going to say, and that is when Congressman Cooper agreed to sign on, he said, you can feel excited about this, but don't feel excited for very long because you've still got a whole lot of work to do. And I said, tell me specifically what you think we need to focus on. He said, you need to get business signed on in support of this, and you need bipartisan support. You need Republicans. And so I took that very seriously. And we now have an entity, a campaign called Business Leaders Transforming Healthcare. It's run, at the helm of it is a man named Richard Master, who wrote and directed the movie Fix It, the documentary Fix It.
Oh.
Healthcare at the Tipping Point. I highly recommend it. You can see it on YouTube for free or on their website.
Called Fix It?
Fix It.
Okay.
Healthcare at the Tipping Point. He is a businessman. He owns a mirror and frame manufacturing company in Pennsylvania. And he said, absolutely, the fact that I have to negotiate health insurance year after year after year is cutting into my ability to grow my business and to give my employees raises and to increase the number of people I can hire.
It's crazy.
The National Health Program is a job creator. So
what do we need to do? What do we need to do to go make this happen?
We need to gain the support of the business community, and we also need to gain the support of conservative members of our society who are going to be just as much hurt, if not more hurt, by the American Health Care Act, if it actually goes through, than other people. We need to help them see that this is not a partisan issue, that healthcare is a social good for all Americans. And as I said at the beginning, I want good healthcare for everyone in America. Everyone, including people who on other issues may not agree with me on, liberal, conservative.
So would it be fair? Would it be fair to say that you want health care for everyone in the same way that we want education for our children up to high school, and a program that's put into place that makes it available that people can get those services without having to pay extraordinary fees and costs and all that? I mean, isn't it the same?
Pick your issue, whether it's education or police. I mean, I was burglarized a few years ago. And when the police came to my house, they didn't ask whether I had police insurance or not to decide whether or not they were going to investigate the crime or help me. If I had a fire at my house, I don't think the fire department is going to come and say, well, you didn't pay your fire insurance last month, so we're just going to stand here and let your house burn down. So there are some things that are just a social good that really don't lend themselves to commodification. And I would say that healthcare is one of those. And it's just time. We really are ready. I think the American people are ready. And frankly, the last time the Republicans tried to pass this piece of legislation a month ago, we saw an increase in co-sponsors of H.R. 676 to the tune of 24. So now that they have passed their AHCA and are sending it on to the Senate, I full well expect to see many more co-sponsors of H.R. 676, because these members of Congress are going to go home in the next week and they are going to get an earful from their constituents. So I actually won't be surprised if we have our first Republican co-sponsor in the next couple of weeks.
So how do people learn about that particular bill, and how do they go about supporting it?
There are three ways I would recommend, and they're all websites. There is my organization as president of PNHP. That's www.pnhp.org. There is I'm also on the steering committee of a campaign called healthoverprofit.org. And that is a website with a number of very helpful and very, very readable to the average citizen. You don't have to be a doctor to go to that website and understand what they're helping you to and encouraging you to do. And then healthcarenow.org is another grassroots organization. So I think
so when you go to these organizations, these websites, you're going to learn about what this is about, but then do they give you specific things that you can do to move this forward?
Yes.
Good.
There are places on the PNHP website, and there is an entire category called tools on the Health Over Profit website that give people specific, doable things that they can do to contribute to growing this movement.
Wow, fabulous. Well, you know, I support you 1,000%, you know, and here at the Karma Institute, we say good karma is by choice, not by chance, that it's a conscious effort that we all have to step out and ask and demand that we have the integrity in all aspects of our life, and in this situation, integrity in our healthcare. And I want to commit to you, Dr. Paris, that anything that Karma Talks, Mark Hughes, or the Karma Institute can do to support you by getting the word out and educating people and creating a mass effort to make this happen, you have my full support. Thank you so much for joining us. I hope you'll come back again, you and maybe some other your associates, and we'll have a more, continue with the dialogue and let people know that there really is a choice to have health care for everyone. And it starts with everybody taking the steps and the action, because we're in a really finite window. Wouldn't you agree?
Yes.
To make this happen.
Now
so the time to do it is now. Go ahead. I'm sorry.
Now is the time.
Great. All right. Well, thank you again for joining us. This is Mark Hughes with Karma Talks. This has been fantastic, and I'm sure we'll be talking about this again soon. Take care, everyone.